Have you ever looked at a chest x-ray and just seen, well, a bunch of confusing black and white blobs? And you wonder, what is a doctor actually seeing in there? Well, today we're going to pull back the curtain and demystify this together.
I mean, it's a fair question, right? You're looking at this image, and it's like a really complicated puzzle. What secrets are actually hiding in those shades of gray? What are the key clues that a trained eye is looking for to figure out what's really going on inside someone's chest? And that is exactly what we are here to do. We're going to break this whole thing down for you, simply, visually, and fast. I promise, by the end of this, you'll have a really powerful, systematic way to start making sense of it all. Okay, first things first. Before you can even start to read an X-ray, you have to know what kind of view you're looking at. Because believe it or not all chest X-rays are created equal. We've got to start with what's called the gold standard, the chest PA X-ray.
So you'll hear this term PA. It just stands for posterior anterior. Now that's a fancy way of saying the X-ray beam shoots from the patient's back, that's the posterior side, and comes out through their front, the anterior side. It might sound like a tiny technical detail, but trust me, it is absolutely crucial for getting an accurate picture.
And this slide shows you exactly why that matters so much. On the left, that's our standard PA view, but on the right is an AP view, where the beam goes from front to back. Just look at the difference in the size of the heart. It's night and day. In that AP view, the heart looks way bigger than it actually is, which can be super misleading. The big takeaway here, the PA view gives you the true accurate heart size. All right, so we've got the right image. Now what? How do you actually read it without getting totally overwhelmed and maybe missing something really important? Well, you need a system, a reliable, repeatable method that tells your eyes and your brain exactly where to look. And here it is. It's as simple as A, B, C, D, E. This is your mental roadmap. A is for airway, B for bones, C is for cardiac, D for diaphragm, and E is for everything else. It's simple, it's memorable, and it works. So let's walk through it, one letter at a time. First up, A for airway. We're looking at the trachea. That's the big, dark column of air you see running right down the middle of the chest. And the number one question you ask yourself is it central? Is it sitting right there in the middle? Because if it's getting pushed or pulled to one side, that's a massive clue that something else is going on.
Next up, B for bones. Now you let your eyes systematically scan the entire bony cage. You're going to trace every single rib one by one from the back to the front. You check out the clavicles, the collarbones, and any part of the spine you can see. Are they all in one piece? Do you spot any little cracks or, obvious breaks? It's like being a detective.
C is for cardiac. And hey, remember how we talked about that PA view? This is where it becomes a huge deal. We use a simple rule of thumb called the cardiothoracic ratio. Basically, the widest part of the heart should take up less than 50% or half of the widest part of the chest. If it looks bigger than that, it might be a sign of an enlarged heart.
Okay, moving down to D for diaphragm. This is that big muscle that separates your chest from your belly. You should see two nice, clear, sharp domes. And here's a cool little fact. The dome on the right is usually a little higher than the left one. Why? Well, your liver is sitting right underneath it, kind of pushing it up. What we're looking for are crisp, sharp edges.
And finally, E for everything else. Think of this as your final sweep, your catch-all step. Now's the time to scan the lung fields themselves for any weird shadows or patterns. You're also going to check the soft tissues outside the ribs. And most importantly, you have to check the angles, which actually brings us to an awesome pro tip.
Because let's be real, sometimes the most important clues, the real game changers, are hiding in the tiniest little corners of the image. An expert knows exactly where those hiding spots are, and they make sure to check them every single time.
So, let me throw a term at you. Costophrenic angles. Yeah, it sounds super technical, I know. But finding and really looking at this one specific area is one of the most critical parts of reading a chest X-ray.
But let's break it down. It's actually pretty simple. Costo just refers to the ribs, and phrenic refers to the diaphragm. So the costophrenic angles are just those sharp little corners on either side where your diaphragm meets up with your ribs. You can see them highlighted right there.
And here is the money tip. Normally, those angles should be sharp, like really pointy. But if they look blunted, more kind of rounded off, as if something's filling them in, that is a classic red flag. It can be a sign of what's called a pleural effusion, which just means there's fluid collecting in the space around the lung.
Okay, let's pull all of this together. What is the single most important thing to take away from all this? It's that reading an X-ray isn't about having some kind of magical superpower.
It is all about having a powerful system.
This really says it all, doesn't it? The ABCD method, it's not just some little trick to help you remember things. It's a real framework that takes this confusing black and white image and turns it into a diagnostic tool that you can actually understand. It forces you to look at all the important spots every time so you don't miss anything.
You know, we started this whole thing by asking what a doctor sees in an X-ray, and the answer is they see a story that they piece together by following a system, step by step. So now that you have a system, the real question is, the next time you look at one of these, what will you see?